Hello, I'm Jean Pete, and I welcome you back to our show, Better Living. Better Living is brought to you by the Homestead Hope Foundation and is sponsored by Homestead Hospice, where commitment to education and premier hospice care helps patients and families through life's most important journey.
Thank you for joining us again this week. We have another great show in store. Today, I am here with Dr. Stephen Kim, who is an orthopedic surgeon with Resurgens Orthopaedics, and we're going to talk about knee and hip replacement. We also have a guest patient, Jerry Niemeyer, who's going to talk about his knee replacement experience. So get your pen, get your paper, and get ready for another great show. Dr. Kim, thank you. Welcome to Better Living, and thanks for joining us today.
Thank you. It's my pleasure being here today.
So why don't we talk a little bit about you? How did you get involved in orthopedics?
Well, I always had an interest in medicine, and when I first started in medical school, I obviously didn't know exactly what I'd be going into, but I spent some time actually doing some research in an orthopedic laboratory, and without any intention of going into orthopedics, first surgery I ever saw was a knee replacement, coincidentally. I thought it was the coolest thing ever, and ever since I've just really been dead set on doing that.
And it was a long road of medical school after that first.
Yes, it was.
Because you said, get me back to the knee and hip replacement.
Yes, exactly. It's been a long road, but it was definitely worth it. It's still to this day, it's just a fascinating surgery. I really enjoy doing what I do.
Now, do all specialists go through a fellowship?
No, so orthopedics is a field on its own. You do a residency in orthopedic surgery, and that's more of a general education in all different disciplines within orthopedics. Total joint replacement is just one field within orthopedics, and I've done specialized training, additional training in joint replacement, especially some of the more complex cases, some of the newer techniques, and especially the revisions and kind of redo operations.
When you say joint replacement, we know hip and knee. What are typical joint replacement procedures?
Hip and knee are by far the most commonly replaced joints. They're just surgeries that we've done the longest and really had the best track record with. They just work really well. There are other joints that are replaced, such as the shoulder, the elbow, and ankle on occasion, but those are really fewer as far as the volume of operations performed.
I actually do know someone who is waiting to hear about a shoulder surgery. She was a softball player, catcher, throwing, and her shoulder continues to pop out, and I see her at night, and she's got ice on it all the time, and so that's another very important, well, you know, anytime you have something that's not working on your body. But is the shoulder replacement, I know we said we were going to talk about knee and hip, but it's all about me, and I know someone who needs a shoulder. No, I'm kidding.
Yeah. Well, the shoulder, you have to really recognize what's causing the pain, and joint replacement is just one type of joint surgery that we do. That's really when everything else fails and the joint has really worn out. But if the joint is unstable, dislocating, it's not necessarily that the joint is worn out, but a lot of the soft tissues around it have failed. So your friend sounds like she may need possible either physical therapy or some surgical procedure, but generally not a joint replacement unless the joint itself has deteriorated.
I see.
That's what we're really addressing with the joint replacement, when everything else has kind of worn out.
So you're going to try everything else, of course, before you go ahead and replace the entire joint.
Exactly. Once you do the joint replacement, there's really no going back. There's no more joint left because we're basically cutting out the remaining joint and putting in an artificial implant there to kind of fill and take the place.
So let's talk about hip replacement. Is there a typical demographic for patients that come to see you that you're performing these hip replacement surgeries on?
Well, when joint replacements were first started in this country, really about 40 years ago or so, technology has really advanced since then, but the lifespan of the implant really wasn't that long, so we generally designed the surgery for more sedentary people in their 60s and 70s so that they wouldn't need multiple operations. But as technology's improved and as our population has aged, and also people are just a lot more active than they used to be, we do this on younger and younger patients. We still try to exhaust all conservative measures before going ahead with surgery these days, but when the joint is worn out and everything else is failing, people want to have the replacement done so they can get back to their active living. I've done joint replacements on people as young as in their 20s for other medical reasons, but we still typically try to wait till they've really exhausted everything else.
So what are some of those procedures that they should exhaust before coming to you and saying, just take the whole thing out and give me a new one, doc?
It's based upon the diagnosis, but if the joint itself has worn out, at an early age, a lot of times that can be from other reasons, not just osteoarthritis, but it can be something like rheumatoid or lupus or avascular necrosis, where the blood supply to the bone dies and then the femoral head, which is really the ball portion, collapses. When that happens, the joint is pretty much gone, and at that point, there's not much else you can do. But if it's something like rheumatoid or an inflammatory arthritis, you certainly try different types of medications to control those symptoms. And it's really about symptom control, because the surgery is really for pain relief more than anything else. If those medications like anti-inflammatories or different types of injections like steroid injections aren't controlling the pain and it's affecting your quality of life, that's when it's really time.
No matter how young.
The younger you are, we certainly try to avoid surgery if we can. Again, because even with the better technologies, these don't generally last the rest of your life. So you have to go in with the expectation at an earlier age that this is going to be one of multiple surgeries. If the patient has really exhausted everything and they understand this, then that's when it really is time.
Yeah, because going back to my friend who has severe pain in her shoulder, she's so young. And I think that the physicians that she's seeing are really trying to avoid the surgery. But from what I'm seeing, outsider looking in, she's a tough cookie, not a complainer. And she might be one of those young girls that is just facing a total replacement.
Possibly down the line, certainly. But from the sounds of it with your friend, if stability is an issue, you were saying that the shoulder is popping out of place. Actually, a lot of times the joint replacement that we put in, shoulder, hip, or knee, is less stable than the joint you have in there. So that may actually worsen the problem if stability is an issue. So you may need a different type of procedure than a joint replacement to really address the soft tissue laxity that's there.
Wow. So be careful, athletes. Make sure you do it right. Okay, so back to the hip replacement. Do you want to walk through what happens when someone comes to you and they need a hip replacement?
I am a hip knee specialist, so I'm usually seeing more people who have had hip pain for a while and have really gone down the course of conservative management with their primary care physicians or whomever, and they've tried anti-inflammatories and activity modification. But when they see me and it's just continuing to hurt, that's when we talk about surgery. A lot of the success with joint replacement really comes from the discussion that I have with patients beforehand, especially what they can expect from surgery and their expectations and what is required of them after surgery to really fully recover. Also talking a lot about the risk, benefits, and alternatives, because this is joint replacement surgery. It's not life or death operation here. So I really do want them to fully understand what they're getting into, and by them knowing all of this, the better they're going to do.
Well, again, and that's what Better Living is all about. We want to educate and inform so that you can make the best decision and the right choice for you. So really, everything has to do with preparing yourself and understanding what the ramifications of your decisions are so that you can make a good decision.
Certainly. And getting back to that point, that's the big discussion when we first talk about surgery. I describe the surgery to them, but that's not as important to them because they're asleep during the surgery. I'm the one doing it. But what they can expect from it and
patients,
afterwards,
they make the doctors do all the work.
Yeah. Their job is really doing everything to recover well so that they have the best outcome possible and that they know what to expect from surgery. And that's what I spend a lot of time talking about beforehand. After we talk in the office and it's decided that they're going to go down the road of surgery, we really try to do everything in our power to make sure that the patient is really optimized for surgery. And that includes seeing their medical doctor, making sure they're in good health for surgery, that they can tolerate the surgery itself without causing worse harm. And also we have them go to a joint class, which really teaches them a lot about what to expect before, during, and after surgery. And that really is what prepares patients the best for good outcomes down the line.
Yeah, for me, it would be, okay, what kind of pain meds are you going to give me when I'm done?
Yeah, and certainly there is expected pain afterwards, much more so for the knees than the hips in general. But it is an expected thing, and patients have to understand that. And only by accepting that are they going to actually get better from it. Okay,
here's where maybe you're not going to like me. So get ready to banter, okay? I do have a background in hospice, so clearly I'm a let's make you comfortable and manage your pain kind of girl. And sometimes I feel like I wish they knew just how much pain we're in when we come back home. And there's got to be something we can do, because I've always been taught in working in hospice that if the body's in pain, the body is taking all of its energy to focus on fighting the pain, which compromises your immune system, which makes you more susceptible to get sick, which gives you a longer recovery. And so, I didn't tell you I was going to ask you this, and I didn't plan to ask you this, but I'm so glad you're here because I feel like we're friends, and you're a safe orthopedic surgeon to ask. Mm-hmm. But regarding pain management after these procedures, isn't there something more we can do?
Well, actually, that's a great point. Joint replacement, it's a painful operation, but in the last 10 years or so, it's really a whole new ballgame as far as pain management after surgery. After joint replacement about 10 plus years ago, people really would stay in the hospital for sometimes up to a week for a routine joint replacement, and a lot of it was because of pain, and they just couldn't get up and moving after surgery because the pain was so severe. And commonly, the pain control would really entail giving high doses of narcotic pain medications, which could potentially lead to lots of other complications and the patient really being quite lethargic. Right. But it's really an entirely different game these days. It's a multimodal approach starting from the joint class before surgery, because really the more you know and that you expect the pain, the better the patient's going to deal with it. They are very well prepared these days. Before surgery, they get a whole new cocktail of different medications beforehand to help pre-treat and hopefully decrease the amount of pain that they experience after surgery. And that has to do with the anesthesia. It's no longer the anesthesiologist is just putting you to sleep. They're also managing your pain and expected pain beforehand. And also the type of anesthesia that we do is entirely different. It used to be that you used to get a general anesthetic and you'd be out during surgery, and afterwards there's no pain control component to the anesthesia. Nowadays, for the knee replacements, at least in our center, we're doing almost all of our surgeries with femoral and sciatic peripheral nerve blocks, where the nerve is deadened with a local anesthetic, and that really works for about 2 days. And during that first 2 days, that's when a lot of the severe pain occurs and your recovery. And that decreased pain from the nerve blocks has allowed people to really get up and get going right away, even the same day as surgery.
That's great. So there's been a lot of advances in pain control for these orthopedic procedures.
Yeah, and rarely is it the case where my patients require high doses of narcotics after surgery. So they will be on pain medication, but it's not to the point where I'm concerned about them not breathing or having other complications because of these medications.
That's good to know. Thank you for letting me put you on the spot. You're a good sport.
Not a problem.
Okay, so back to the whole hip replacement, because I know we want to get to your patient, Jerry, and talk about his experiences with knee replacement, but I do want to finish our chat about hip replacement. Mm-hmm. What is hips resurfacing, and how is that different from hip replacement?
I'm glad you asked. Hip replacement is the traditional surgery where basically we are cutting the ball off and we're taking that out. That's really a lot of times the disease portion of the hip, and we're replacing with a metal stem that goes inside the bone, and attached to that is a new metal ball. It sounds like medical carpentry, and that is kind of what we do. The resurfacing is a different operation altogether. I don't treat it as the same type of surgery itself. It is a little more involved from a surgery standpoint, but rather than cutting the bone, what we're doing is pretty much dislocating the hip out of place, and we save that femoral head, which is the ball portion. And instead of just cutting it off and getting rid of it, we shape it to fit a metal cap that fits over there. That is a different operation for a different type of patient.
I'm glad you're the surgeon, because I'm just not thinking that would be fun.
Yeah, it's not, but it's a bone-conserving operation, and I really use that for a younger, very high-demand active patient. There are additional risks involved with the resurfacing that a hip replacement does not have, and so it really is best reserved for a specific type of patient. But the patients who are candidates and have had it done have really had extremely satisfying experiences with it.
Real positive results. Is there a difference in how long it lasts? Because we know you have to go back in. They don't last forever. Like you said, it's not a lifelong replacement.
The hip replacements, they last a lot longer than they used to. It used to be the resurfacing population I'm talking about. Let's step back. That's about usually men, active men, doing a lot of high impact exercises, age 60 and younger. If I were to do a total hip replacement on that type of patient, it used to be that they would wear that hip out within probably 10 years or so. Nowadays, the technology is a little better, and those replacements will last probably more like 20 plus years, but we still don't know the long-term data with that.
That's a huge improvement, 10 years. You just doubled
It certainly is. And it could potentially even be longer than that. But with the newer technology, we still don't know the long-term outcomes, how well they're ultimately going to last. The resurfacing, it's a newer operation that's really been, at least the modern resurfacing, it's been in use worldwide about 14 years, and that's about the longest that we have as far as data. It is implant dependent as well, but certain implants really do last a comparable lifespan as compared to a total hip replacement.
It might just be me, but I'm just a little bit unclear. For the resurfacing, you're using that as an option for a younger population because it gives them more range of motion? Because you just told me that time-wise it might be the same before they need another procedure. So can you just elaborate for me?
So that gets into some of the benefits of the resurfacing, and these are potential theoretic benefits. We're conserving bone, and one of the hopes is that I let my hip resurfacing patients go to high levels of activity afterwards, after everything fully heals up. And that includes running and impact type of exercises. Whereas a hip replacement, I generally don't recommend that my patients run or do any high impact exercises after this has been done. It's potential to last equivalent amount of time, but with potential for higher levels of activity.
So am I right to deduct that we're going to see an increased use in hip resurfacing versus hip replacement?
Actually, probably the contrary. And the reason being is that the hip resurfacing, we're also replacing the cup side, similar to what we do in a hip replacement, but the bearing surface itself, it's called a metal-on-metal hip, where the cup side and the head side are both made of metal. And the traditional hip replacement is actually a metal ball with a plastic, it's a special type of polyethylene plastic on the cup side. We went to things like metal on metal to provide potential long-term wear because the plastic is what would used to wear out soonest back in the older generations of hip replacement. But what we've learned is that metal on metal hip replacements can cause problems as well. And there have been reports of hip recalls in the last several years, and some of this is related to metal on metal technology. And so you really have to be quite specific, and I have a long discussion with people who are going to have resurfacing regarding this, but if you choose the right patient, their risk of complications and success with the resurfacing is actually very, very good.
So the long and short of it is, for those folks that are listening, we want you to know that you have options and that you should be discussing these options with your orthopedic surgeon, because it may be that resurfacing is right for you. It may be that a total hip replacement is right for you, but you have to discuss the qualifiers in your health and all of the other criteria and listen to your physician before you make that decision.
That's exactly an accurate point. When we decide surgery for end-stage arthritis of the hip, I have a lengthy discussion with my patients regarding what type of surgery is the best for them, what type of bearing option is going to provide them the best options. And it's not my decision. Ultimately, I give them the pros and cons, and we discuss the risks and benefits of all the decisions. But ultimately, the patient decides what is going to be the best procedure for them with an informed decision.
Wonderful. Now, how many hip and knee replacements do you do each year?
I do several hundreds. I don't know exact numbers, but several hundred a year. By far more hip replacements than I do resurfacings, because it is a smaller population where you're really going to find that right indication for surgery there.
For the resurfacing.
For the resurfacing,
yes. I see. Now, we kind of jumped right into the procedures that you do, and you've been so informative today, but we sort of skipped over who you work for and where you are and all the good things about Resurgens. So why don't we take a minute before we have to go to break and talk about Resurgens?
So I work for Resurgens Orthopaedics, which is the largest orthopedic group in Georgia, and actually the third largest group in the United States as far as number of orthopedic surgeons. We pretty much service the entire metro Atlanta area with 21 different offices. And within our different offices, it's kind of broken up into regions. Otherwise, it'd be a logistical nightmare. Within our group, we really have a lot of different subspecialties covered within orthopedics. I'm one of the subspecialties, which is joint replacement, but there are others such as sports, spine, hand, and trauma, foot and ankle, things like that. So we really do have a wide net. I feel that we provide widespread coverage all over Atlanta with subspecialized care.
Great. And you're at, just to recap,
Marietta, Town Lake, and Canton. And I perform all my surgeries at Kennestone Hospital, which is a Wellstar Kennestone.
Great. Just to remind you folks, I'm Jeannie Pete, and you're listening to Better Living, and we are here with Dr. Kim from Resurgens Orthopaedics. We're talking about hip and knee replacement. We've talked about the differences between hip replacement and hip resurfacing and some of the benefits of each of those procedures. And we're going to take a quick break, and when we come back, we have the pleasure of talking to one of Dr. Kim's patients who recently had a knee replacement, Jerry Niemeyer. So stay tuned, and we'll see you in just a bit.
Hello, I'm Jean Pete, and I welcome you back to our show, Better Living. Better Living is brought to you by the Homestead Hope Foundation and is sponsored by Homestead Hospice, where commitment to education and premier hospice care helps patients and families through life's most important journey.
Welcome back to Better Living. This is Jeannie Pete, and I am here again with Dr. Kim from Resurgens Orthopaedics, and we are here with one of Dr. Kim's patients, Jerry Niemeyer. We've been talking to you about knee and hip replacements and joint replacements and the ins and outs of how you can make the decision that is best for you based upon the information that Dr. Kim is giving. And I'm excited for the next half hour because we're going to hear from an actual patient and walk you through his story and hopefully educate you so that you can make that right choice. But before we do that, Dr. Kim, why don't you give your contact information for anyone who's listening and says, you know what, I really am in a lot of pain, I'm at the end of my rope, and I want to talk to this guy about what my options are.
I'm at 3 different offices, but my primary office is in Marietta, Georgia, and the office number over there is 770-422-3290. I'm there most of the week. You can also find our information on our website, which is www.resurgens.com. It is a little complicated because it is such a large group with multiple offices. You do kind of have to navigate your way through the website a little bit, but if you look up the Marietta office, that's where you'll find me.
And again, that's 770-422-3290.
Correct.
And, you know, we do air in different markets. We air in New Orleans and Phoenix, Arizona, and the Gulf South into Mississippi and northern Florida. And I know that we're talking with Dr. Kim today, who's here from Resurgens Orthopaedics in Atlanta. But if you are in a market that Resurgens is not in, this is terrific information to arm you with so that you can call a local orthopedic surgeon in your community and you're armed with the information that you need to ask the right questions to help you determine your best choice. So stay tuned because we've got a great show in store. Jerry, thanks for coming today.
Thank you for having me.
I appreciate you joining us. Poor Jerry, we gave him the wrong address, and he's been driving all over the city. I told him we were just working him up to get the adrenaline running so we could have a good show for you all today.
Well, you succeeded.
But you're not going in for another surgery, so it's got to be better than that.
It is, absolutely.
So we were talking to Dr. Kim in the first half hour about hip replacement. We're going to get into the knee replacement, but before we get into the ins and outs of the medical information behind knee replacement, let's hear what your story was.
All right. I had been going through a lot of knee pain, and it was getting progressively worse. And I'm a very active person. I play tennis and golf. I play softball. I ride bikes. I do all of that. And it became increasingly apparent that I wasn't going to be able to do it much longer because the pain was just debilitating. Range of motion was almost gone, and I needed to find an answer. And a friend of my wife recommended Dr. Kim, and that's where we got started.
So, you know, because you're so active and healthy, and what I notice in active folks is they put it off. And they put it off, and they just keep popping Tylenol and ibuprofen and getting the ice out and saying, no, I'm tough, and I've been playing these sports my whole life, and I can handle it. Are you glad you waited so long, or should you have seen Dr. Kim a little earlier?
Well, I think the timing was actually just right. I don't think that if I had gone to him a lot earlier that it would necessarily have been an option. It kind of puts me outside the prime age range for the procedure. I was able to get by. It wasn't real comfortable, but I was able to get by. But it just finally reached a point where I knew that something had to change.
And so you went to see Dr. Kim.
I did.
And what did Dr. Kim have to say?
He said, "You're worn out." It was very interesting process, and it was about what I expected in our initial meeting. The thing that I was concerned about was having one done or having both of them done at the same time. And Dr. Kim went through that evaluation with me to try to determine how we would do that. But I just knew that I was ready to have it done, and I was prepared for whatever happened after that.
So one knee was worse than the other.
Well, I suppose they were, but they both needed to be
taken
done.
care of. Okay. So Dr. Kim, you're probably chomping at the bit to get a little airtime here. So Jerry came to see you and walk us through what you found and how you helped Jerry decide what was the best decision for him.
So when I saw Jerry, he came in really at the perfect time, just as he had described. He has really been very active his entire life and wanted to stay active. And when I first saw him and I first saw his x-rays, I pretty much told him his knees were worn out. I pretty much relate joints to tires on a car, and I tell people some tires are better than others, and that's genetics. But regardless, the more you use them, the faster you're going to wear them out, and he certainly put them through the ringer. He also had a pretty significant deformity of the knees from the type of arthritis that he had. So I told him, at this point, the diagnosis is there, and basically the decision for surgery is on you if and when the pain is severe enough, and this is what we can do to help you. Since both were worn out, we did have to decide, do we go ahead with one or both at the same time?
Yeah, I want to talk about that a little bit because for me, I don't want to be down. So to me, I don't know that I would even give my doctor a choice.
Yeah. Well,
how do you make the right decision?
The right decision, part of it is the patient's choice, but a lot of it is also, are they medically able to tolerate having both done at the same time? Because it's not just double the risk of having one done. It's really quite a bit more than that. The risk of complications is just a lot higher, and you really have to be the right patient in order to even be a candidate.
So you're going to really look at the health.
Exactly, and discuss it with the patient and make sure they're aware of the additional risks. And I generally tell them that if you want the safer option, it's going to be having one done, waiting till you're recovered from that, and going ahead with the other. And that usually is about a minimum of 3 months or so. But if the person has a compelling reason and they're certainly medically fit for it and they're willing to go ahead with it, we do that. It's more pain, but you also have to be ready to deal with that too.
Yeah. So really, it isn't even just health. It's your history of being able to handle pain as well.
Yeah, if somebody is just not going to do well with pain, they're not going to be able to do the appropriate rehab after surgery. And more than the hips, therapy is just tremendously important for a successful outcome with knee replacement, because even if I do the perfect surgery and the patient just does not do any therapy, they're going to be pretty miserable. And if pain is what's limiting them from doing that therapy, then it's probably not the wise choice.
Yeah, we didn't get into the whole therapy talk when we were discussing the hip replacement. So let's talk about that. What can someone who went through a hip replacement and a knee replacement expect in terms of therapy after the procedure?
After a hip replacement, it's relatively simple. Depending on what type of approach is used, there are generally some precautions as far as what position you don't put the hip in to dislocate out of place. And that's the number one primary thing early on that you need to learn. And you work with a physical therapist in the hospital to do that safely, to be able to get in and out of bed, out of cars, things like that, simple day-to-day activities while maintaining those precautions. And then the therapy and recovery after a hip is really more walking than anything else. A knee, it's entirely different because the knee joint, especially people with arthritis, they have restricted ranges of motion to begin with, and they have some soft tissue contractures. After surgery, that knee doesn't want to move, and it hurts a lot, and people don't want to move it. But if you don't move it early on, then scar tissue sets in, and you'll never get that motion back. So I emphasize to my patients before in the office, as well as in the joint class, they learn this. They've got to work really hard with the physical therapy afterwards, because that's almost as equally important as the surgery itself.
Okay, Jerry, I'm going to ask you because that really sounds painful. How were those first therapy sessions?
Therapy was very, very difficult. I had both knees done at the same time.
You did?
I did. And I will tell you that I have a high tolerance for pain, and I learned very quickly to stay ahead of the pain by taking my meds before I went into physical therapy, but it was very difficult.
Oh, I can't even imagine it. I guess I wouldn't be a candidate for both at one time. So I could ask you all I wanted, but you really shouldn't do it if I needed it. Okay, so how long, I'm going to ask Jerry and then I'm going to come back to you, Dr. Kim. Walk us through what happened after your procedure. Help people understand what they've got coming.
My surgery ended, as I was told, I guess, about 10 or 10:30 at night, and I was up walking the next morning with assistance, but I was walking nonetheless. And during the couple days I was in the hospital, physical therapy started right away, started bending, developing range of motion. Before I left the hospital, I was on stairs, a small flight of stairs, working those. When I got home, physical therapy actually started at home. We had a person who came into the house, and she spent an hour with me each time that she came in, doing things that I could do in the house, sitting on a chair and bending my leg backwards, straightening it out to extend it, all of those type of things. And ultimately, she taught me I could go up and down stairs, and that opened up a whole new life when I found out I could go up and down stairs.
And how long did it take you before you could go up and down stairs?
I think she was with me 2 or 3 weeks, and it was right at the end. So about 2 weeks, I guess it was.
It's really not that bad. You did really well.
I did. And then I got with a physical therapist outside the house, and then the real work started after that.
And how long did your therapy last for?
Well, initially I was going 3 times a week, and it was about 2.5 to 3 hours each time. We gradually tapered off of that schedule, so ultimately I was down to once or twice a week at an hour a time. It lasted a good 3 months, I would say.
And when you were home, you were continuing the exercises that they were teaching you, because it was really it was your life.
It was real important to continue with what they were doing with me in physical therapy at home. I will tell you, I wasn't as good at that as I should have been, but when I was in physical therapy, I worked very hard at it.
Now, I'm going to suppose here that this story and Jerry is a very positive. It seems to me that maybe Jerry had a really good recovery.
Jerry is a phenomenal patient, especially with the bilaterals. Generally, they take a little longer to recover than a single side, but Jerry really recovered almost like a one-sided knee replacement as far as his time frame, and possibly even better than some. He was just a very hard worker and really followed through with pretty much every instruction that we gave.
So what is typical?
Typically, Jerry did some home therapy, and every surgeon has their different protocols that they have, but most of my one-sided knee replacements will go home from the hospital and then start outpatient therapy right away, only because, like Jerry said, that's where the hard work begins. So they have more equipment, more resources, and that's my preference if they can do it. But if they have a hard time getting around, then we will do home therapy first. And a lot of times the bilateral knee replacements, it is just too hard to get around in and out of therapy, so we'll do home therapy for a little while first. Now, every surgeon is different as far as their preferences, but that's really what I think gets the patients up and moving the best. As far as the time frame, most people are in physical therapy probably about 6 to 8 weeks. And, as he described it, gradually less frequent, but doing a lot more home exercising during the later stages. To fully recover from the knee replacement certainly takes a while, and it takes a lot of hard work.
Sounds like it. Let's talk about fall prevention, because as we're talking about hip replacement and knee replacement, my biggest fear would be to fall.
Yeah.
Do you see that happening a lot with your patients? And
no.
Okay.
And it doesn't happen very much because people are really prepared for it. They go to the joint class, they know what to expect, and they have all the equipment that they need before they leave the hospital. If a patient is expecting to be fully walking out of the hospital normal with no assisted device, that's just unrealistic. And so we quickly give them a little reality check. Almost everybody is walking out with either a walker or crutches if they're a little younger and more active, and they're definitely on that for balance and support for the first several weeks until the strength is back. As far as precautions, especially more so for the hip, they really have to be quite careful following the precautions not to fall and dislocate or have other problems such as a fracture. And with the knee replacements, we definitely give a lot of education in the hospital during the physical therapy sessions on fall prevention.
Okay,
so
good.
Education is really more important than anything else.
And is there the knee replacements more a younger population than the hip replacement?
No, actually a similar population.
Okay.
And knees in general are actually more frequent. There is a higher number of knee replacements done nationwide than hip replacements, just because oftentimes knees go out of alignment a little quicker, more frequently.
And, I had read in the age of the step classes for the women for exercising that it's done such a job on the knees that a huge increase in knee replacements, you'll tell me if this is true or not, that we've seen a huge increase in knee replacements for women in their 40s.
There has been a big increase in younger patients having joint replacements. I wasn't quite aware of secondary to the STEP classes, but arthritis in general, there are more women with arthritis than men, especially with the baby boomer generation. There's a huge increased number of joint replacements overall being done. And as I said earlier with the hip, this is a younger and younger population as well because people aren't willing to curtail their activities and they want to still have quality life and be able to do things that they enjoy doing.
I hope that means that this generation is more active.
Definitely is more active.
That's good.
Yeah.
That's good. Jerry, anything that you want to put out there for someone who might be facing a knee or a hip replacement? I know you had the knee, not the hip, but words of wisdom to share with our audience.
I think you have to really want to do it. You can't go into it with doubt about whether it will work or not. I was convinced that I had to do this, that it was going to work for me, that it was going to be a life-changing event, which it was. And when I was in physical therapy, the thing that got me through that was the fact that I knew that I never had to repeat that day, that once I finished whatever was going on that day, I never had to do that day again because it was tough.
You really need determination.
Yeah, you do. It's not for sissies.
It's not for sissies. Oh, bummer, man. I hope I never need surgery. I'm kidding. It does sound like your frame of mind is as important as your physical ability.
Well, I think so. I knew that I wanted to get back to doing the things that I had always done. I was determined to do that. I was determined to do it as fast as I could. I would probably tell you that Dr. Kim may not have agreed with all the things that I did when I did them, but it worked for me, and I would never say that that approach would work for everyone, but it worked for me, and I knew what I wanted to do and how I had to go about doing it.
One of the things that Dr. Kim said earlier was that it's so important to do what you need to do in physical therapy because if you let it go, you will develop scar tissue, and you'll never get back to the level of activity that you were hoping for. Is that right, Dr. Kim?
Yes. For certain activities of daily living even, you need certain ranges of motion, things like going up and down stairs. And if you just don't get that knee moving, you don't get the knee fully straight or fully bent. And it may certainly limit what you're able to do with the knee.
And so it's not something, because I've recently gotten healthy and lost a bunch of weight, and I wasn't the sprinter, but I was the long distance runner, and I thought, well, it might take me a little longer, but I'll get there and I'll just stick with it. It's not the same kind of thing. You really have got to get in there and get it done, and don't let it go because it'll affect you for the rest of your life.
Yes, you can't wait till the pain gets better and then decide to do it because usually the pain gets better because you're not moving it. Moving it is really what causes a lot of the pain. I tell patients that early on after the knee replacement, if you're not in some pain, you're not doing enough work. Literally, no pain, no gain.
Okay. So again, I just want to remind you that this is Better Living, and I'm Jeannie Pete, and we're here talking with Dr. Kim from Resurgens Orthopaedics throughout the Southeast, but he does work in the Kennestone, Town Lake, and
Canton
yes. offices. And if you have any questions in the greater Atlanta area, you can contact Dr. Kim's group by going to the website at www.resurgens.com, or you can contact him in his Marietta office, which I understand you're at more often than the other offices, correct?
Correct.
And that phone number is 770-422-3290. But again, for you folks listening in from Phoenix or New Orleans or the Gulf South areas that we air in as well, very good information here about joint replacement, hip replacement, knee replacement. We talked about the preparation joint class, and I want to get into that a little bit more before we end our show. And the conversations that you need to have with your physician and how important physical therapy is and your mindset before you elect to have one of these surgeries. Dr. Kim, can we talk a little bit more? Because you've mentioned it a couple of times about how important that joint class is. Can we talk about what they can expect when they attend that class?
Obviously, the hip and knee, there are differences between the two surgeries, but there are a lot of points on what the patients can expect before, during, and after that they learn in that class. And actually, we also insist that they go to the class with a coach or somebody who's going to be helping them afterwards, because it's equally important for that person to understand what to expect so that they're also prepared.
That's a good point. You're going to need to have support after the surgery because you're not going to be mobile for some time. So you've got to get that set up. It's not as good just to have physical therapy coming into your home.
Yeah, the therapist is there several times a week for several hours, but you need somebody to, even simple things like help you go to the bathroom a little bit. And obviously I want them up and moving, but it is a little difficult to get fully around at first, like you had mentioned. So you certainly need somebody there for safety purposes as well.
Okay. So, Jerry, you doing everything you were doing before the replacements?
I'm doing absolutely everything that I did before the replacement and better at it.
That doesn't surprise me. I don't know why. Because you went so full force ahead in the physical therapy, you got yourself in even better shape than you were in before the surgery.
Well, in fact, during physical therapy, and actually it was 50 days after surgery, I was snowshoeing in Colorado. So I had asked Dr. Kim if I could ski, and he said no.
And you did it anyway.
No, I didn't ski, but I said, well, how about snowshoeing? And he said, well, that's up to you.
If you can do it, I said you can do it.
But I'm doing everything I had done before. As I said, it's been a life-changing event.
And how long ago was your surgery?
My surgery was a year ago, December.
So in a year, you're back and even better than you were before.
I was back to playing tennis and golf in 9 months, and I also have a little part-time thing where I drive a bicycle-powered cab on the Marietta Square for Marietta Pedicab.
I love that.
And I was doing that about 4 months after surgery. So
I'm going to come to the square and have dinner and just have you drive me around so I can say, I know him.
That's why we're there. As I was able to work through the physical therapy and become stronger through that and manage the pain through that, I just naturally just started doing the things. I would always talk to Dr. Kim first and say, can I do this now? Or, how soon can I do this? And we worked through that schedule. But absolutely, I was back doing things as soon as I possibly could.
What I'm hearing, Dr. Kim, is, you have a very determined patient over here and probably in the top %. But still, what I'm hearing over and over again is he truly collaborated with his physician in his rehabilitation.
Yes, that's exactly true.
So that's very important, folks. You can't be just doing it on your own. But if you do it, and you do it right, and you push through, and you listen to your doctor, and you ask those questions of your doctor, then you too can be as good or even better than you were before you went in for that surgery. And again, Dr. Kim, they last about 20 years these days?
20 plus. We don't really know the full extent because the newer technologies may even last longer. But again, it is a lot of times mechanically driven, so how active you are, they may wear out sooner.
So if you or a loved one or anyone you know is suffering with debilitating pain, as Jerry mentioned, or just affecting your quality of life, reach out and have that consultation with that orthopedic surgeon and find out what your options are. And again, you can contact or get in touch with Resurgens. You can check out their website at www.resurgens, that's RESURGENS.com. Or you can, if you live in the Atlanta area, contact Dr. Kim at 770-422-3290. If you're in any one of our other markets, please go to the Resurgens website, educate yourself, get the information that you need, and bring that to a local orthopedic surgeon in your area. Dr. Kim, thank you so much for joining us today.
Thank you.
And Jerry, thank you so much for telling us your story. It's an inspiration. I'm Jeannie Pete. You've been listening to Better Living. You have a great week.